Hello, my name is Mohamad. I'm a psychiatrist with the Cognitive Impairment Research Group in the University of Limerick. I'm currently working on a project called the Milford Brain Safe Project, along with a group of multidisciplinary researchers. This project is based in Milford Care Centre in Limerick, and the wider aim of this study is to examine the relationships between symptoms common to patients in an inpatient palliative care setting. So symptoms such as cognitive problems or memory problems, depressive symptoms, pain and fatigue. My research focuses specifically on identifying the best ways to assess for depression. Depression is very common in patients with terminal illness. Around 1 in 6 of palliative care patients have major depression, and the rates tend to be a lot higher for non-cancer diagnoses such as MS and end-stage heart failure. Unfortunately, depression often goes undiagnosed or untreated for a number of reasons. Additionally, patients with terminal illnesses such as advanced cancer often share symptoms common to depression. For example, they may have significant weight loss, significant fatigue or tiredness, and poor concentration, all key symptoms used to diagnose depression. So here's what we found. When we compared various assessment tools in 142 palliative care inpatients against clinical diagnosis made by an experienced psychiatrist, one tool in particular performed especially well. This tool is the Cornell Scale for Depression in Dementia, or the CSDD for short. Unfortunately, the CSDD takes quite a bit of time to complete or to assess properly because it has 19 items and the clinician has to rate the patient for each of these 19 items. So as a follow-on, what we did was we looked at these 19 items and using the data that we have, managed to narrow down the 19 to 5 items that identified patients with major depression with comparable accuracy as the 19 items. This is a really important finding because we now have a brief and simple to use tool to assess for depression that can be used by palliative care physicians who are often under severe time constraints and who may not have extensive psychiatric training in order to identify palliative care patients with major depression. This result raises a few other questions. For one, how well does this abbreviated scale perform in other palliative care settings, such as daycare patients or outpatients? Additionally, will the abbreviated CSDD perform as accurately in other elderly patient populations, such as nursing homes or on a general medical ward?